Now we're going to take a look at setting up an IV bag. Again, we need to make sure that whatever drip set is the most appropriate. Here you see that this is a 60 drop set, and this one here is a 10 drop set. Again, the other one that you may see is a 15 drop set. Okay. Looking at a 10 or a 15 drop set is the most common that we will utilize in the out-of-hospital setting. And we also would realize that a 60 drop set is probably going to be utilized for more medication use. And here we're just going to set up for an IV, and we're going to give some fluid to the patient. So we can just move this one out of the way. And we'll put that one away, and now we're going to take a look at this. And we're also going to make sure that we have our own IV bag. Okay, so first thing is I want to make sure that I have a good, that this is not expired. So I'm taking a look at the expiration date, and I realize that it is 0.9% sodium chloride, also known as normal saline. So this is the correct bag that I want, and with this I'm going to make sure that there's a tab. Now the tab can be in different locations. This tab is on the bottom, and I'm just going to grip this. And now I can reach in and just pull out the bag. And in the process of all this, I'm making sure that there's nothing that's floating in the saline. Okay, I want to make sure that that this is to be a fluid. I've already seen one bag thus far in my career that actually had been gelled. There was I believe it was dextrose that had dextrose containing solution in it. Okay, so here we are looking at 1,000 milliliters, and this is also the equivalent of 1 liter. So I know many of you do know what a liter is, because we're looking at basically a liter of soda that you may end up with. And again, we check this expiration date. Okay. So the other thing that we're now going to do is come back, and we're going to take a look at our set. And we said that this was going to be a 10 drop set. And well, we're just going to open this up. And as we open that up, everything is pretty much packaged together. And we're going to get rid of all this. And this is where I find that a lot of the big issues that come up in setting up IVs is just about right here. So take this set, and you want to put it up as high as it's going to go, up towards the top. And you do this for a reason, because you're reducing the amount of air that may be there. So here we go. I now have this all set, and I'm going to close this off. So this is shutting it down. This is turning it on. We want this shut down. Again, this is covered, so it's going to be sterile. And likewise, this end, when we uncap this, is also sterile, so we don't want to touch what's underneath there. Okay? So for this, I'm going to go ahead and I'm going to remove my spike. And I'm also now going to hold the bag. I'm going to pull this off. Again, garbage, make sure that you're throwing it away. Now I'm going to take this spike, and we're going to put it right into the bag. I want to squeeze this. So if I can squeeze this, I'm going to insert it in a twisting back and forth motion until I meet the bottom, or until I can't go any further. Now I'm going to flip this up. Again, you see that I have this squeezed. I can just open that up. Now there is a small imaginary line, or you can see on this one that there is a small, it's kind of tough to see, but there is a T that is right here. So I just want to allow some fluid to go into this, and that's pretty much all I need. Now here you can see, here's the end of this is the end that's actually going to go into the patient. Now, all I need to do is turn this on, and you will notice that this is running. And then it's going to stop. The reason it has stopped is it has now forced all of the air out of this. So because this is what is known as a vented set, it means that the air has now gone out. So you see here on the sheet, I got one little drop or a couple little drops of fluid that came out, but I have not made a mess. This is now set to go.